Egos, power struggles, and communication breakdowns. Sounds like your typical day? That's been my typical day for the last 30 years as a physiotherapist. I realize that there's two major barriers. One is structural and one is personal. And I have solutions. People are complicated. Put them in a fancy business attire or cool scrubs, it doesn't simplify things. Nor does adding the pressure of taking care of patients. Professional relationships are within the traditional hierarchy. This is the biggest structural barrier to professional relationships in physiotherapy. Modern culture in the West is at odds with this traditional patriarchal hierarchy. People talk about the modern culture wars. These are issues of race, gender, gay rights, and the woke identity politics. Yet modern healthcare still has a hierarchical structure, a power dynamic. Doctors on tops, nurses and physiotherapists with other professionals in the middle, technicians and assistants at the lower level, and the support staff is at the bottom. As an aside, the group that doesn't fit into this healthcare structure are the chiropractors. Some people do not consider the chiropractors part of the healthcare system. And you never see a chiropractor working in a hospital. So some people put chiropractors at the top status with physicians, some put them at the middle level with the other allied health professionals, and some people don't believe in chiropractors. I know we say everyone's important and we're all a team, but even in the Army, there are generals, there's captains, there's sergeants, and there's privates. Everyone has their role. This is the big structural barrier to professional relationships in healthcare. 3 parts to this barrier. 1 is time constraints. Everyone is so busy with the patient in front of them that it's hard to think about anything else. 2, knowledge gaps. Every profession sees the patient from a slightly different point of view. And 3, boundaries between professions. Everyone works in their own silo. Sometimes there's little opportunity to communicate. Some physios don't hardly talk to other physios working in the same clinic. So we can't rage against the system, whatever the system really is. But we can treat each other well, one-on-one, as individuals, with some love and compassion. We do this by fighting the ego. Ego is the biggest personal barrier to professional relationships. The ego resists teamwork, it doesn't grow from feedback, and it's unwilling to compromise. This was my rant at the beginning. Ego, power struggles, communication breakdowns, oh my. 3 solutions: shared goals, take responsibility, and dialogue. Solution 1. Commit to shared goals. This is framing communication about what's best for the patient. This is shared goals. This is avoiding blame. This does not put other professionals down. Don't badmouth anyone in front of your patient. Solution 2 is take responsibility. Responsibility here is modeling professional behavior. This is how you dress, this is how you act, this is what you say. Responsibility is respect for the roles and expertise of others. Everyone has value. And responsibility is avoiding power struggles or attempts to dominate other professionals. That was my aside earlier about chiropractors. I'm not trying to put them down, and I'm not trying to hold them up, but you need to realize that there are different opinions. Solution 3 is dialogue. People talk about the importance of open negotiation and honest communication. 3 elements to dialogue. Dialogue is a clear scope of practice, a clear responsibility with other professional, share relevant information, and integrate input from other professionals into your physio decision making. Dialogue is addressing conflicts and misunderstandings. De-escalating that conflict and misunderstandings is so important. This is empathy, this is simple language, this is clearly defined roles. Dialogue is also about being honest, not in the sense of lying or cheating, but rather being free of hidden agendas. I know some clinics are so cash poor that they need the money just to stay open. But be aware of those personal biases. I know I have a strong bias against spinal surgeries done for pain relief. I don't know if they really work. So don't just talk about putting the patient first. Prove it through your actions. Be the mature one and hold yourself accountable. Make your patient's well-being the focus of working with other professionals. That's how you get ahead in physiotherapy. That's how you have better professional relationships in physiotherapy. We've all met those big egos. We've all struggled to communicate. I don't need your horror stories. I have my own. What solutions did I miss? Share your positive stories. What works for you? Let us know in the comments below. My 2 books are now available at Amazon. What they don't teach you about documentation in physiotherapy school, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. You're going to love this video, and let the subscribe button be your portal to more adventures. Thank you.